Hi everyone, greetings everyone. Today's online session is about permanent mandibular incisors. Uh, I know you're able to see this tooth, but it's not moving. But the PowerPoint slide that I'll be giving you will have this tooth rotating around its axis. So a little bit, I will start with disclaimer. A lot of pictures that are in this presentation have been taken from Google Images and a book of dental anatomy by Royalfield as well as by Wheelers. Um, and I have taken it from many different sources. Uh, Furthermore, these online sessions have three sections in them. The first section will be on the identifying and distinguishing characteristics of permanent mandibular incisors, followed by the role of permanent mandibular incisors in terms of form and function and contacts and embrasures. And lastly, there will be detailed description of both the central permanent mandibular incisor as well as the lateral permanent mandibular incisor. Now, a lot of students have difficulty in understanding the identifying and distinguishing characteristics of teeth, and most of them they look alike, and it's very different. It's very difficult to differentiate them. So my advice to all of them is that it is better to view this presentation or this video along with the models in hand. So you can just pause or at any moment, and then you can just view these models that have been given to you and uh, try to correlate these models with the presentation or with this video. Okay, so without further delay, we'll move on to the learning objectives. So the learning objectives of this session, of this online session, are to identify the mandibular incisors on the models as well as the pictures, and to know their identifying and distinguishing characteristics. In the third section of individual identifying and distinguishing characteristics, we have five surfaces of teeth: the labial surface, the lingual surface, the incisal surface, and the mesial as well as the distal surface, which are known as the proximal surfaces. So we have at least characterized 5 points on each of these five surfaces. So we have something like 25 points of identifying and distinguishing characteristics that can help you to identify these teeth and distinguish them from all the other teeth in our oral cavity. So, and that is the main function, or the main take-home message is that you should be able to compare and contrast the mandibular incisors. Okay, so if you just look at this picture, uh, what is the first thing that you're able to view, or the first thing that comes in your mind? Now, I know all of you will be looking at this person's missing uh, laterals, but the reality is that he has a missing left eyebrow, but no one noticed that. And the reason why no one noticed it's because the first thing that we look at is the teeth. So by this picture, what I mean is the importance of aesthetics. Mandibular central incisors, mandibular lateral incisors, as well as the maxillary centrals and laterals are very important aesthetically. Okay, as this is the first thing that we, when we look at a person, then we look at his front teeth. And maxillary and mandibular, centrals and laterals are one of the first things that a person views whenever he sees anyone. While the posterior teeth, they are not as important aesthetically as the front. Okay, so now we start off with the first part of this online session, and that is the description of the mandibular incisors. Now, the mandibular incisors are shown here. There are four teeth, in number in the mandibular incisors, and I have written here their universal numbers, because students find difficulty in memorizing these numbers. So they are 23, 24, 25, and 26. Now, whenever we try to understand the identifying distinguishing characteristics of mandibular incisors, we need to know the arch types, or the arch triads, the class triads, so that we can distinguish and compare and contrast them with the namesakes in the opposite. So now, as we know that during the development stage of incisors, the incisors, they usually develop from different lobes or centers of calcification. In the anterior teeth, they usually develop from 4 lobes or centers of calcification, and these lobes are centers of calcification. They later on coalesce or join together to form a mature tooth. So all of the centers and laterals, whether they're maxillary or whether they're mandibular, they all have 4 lobes or centers of calcification. Now, as we know, mamelons are one of the identifying and distinguishing characteristics of centrals and laterals, be it maxillary, be it mandibular, and these mamelons, they are actually manifestations of the lobes or centers of calcification. So we have 3 lobes on the facial surface and 1 lobe on the lingual surface. Okay, so this lobe, or this part, is known as the mesophacial lobe, and for the mesophacial lobe, this mamelon, or this part of the tooth, is visible. And then we have the midfacial lobe, and lastly the distofacial lobe. So we have 3 lobes or centers of calcification: the mesophacial, the midfacial, and the distofacial lobe. And there is another lobe which is on the lingual side, and that usually corresponds to single. So we have 4 lobes in any anterior tooth. Usually these lobes are separated by developmental depressions that we see here, but what happens is, with wear and tear, these developmental depressions also disappear, just like the mamelons. And this is what we need to know, that the usually changes with function. So mamelons, if you see, mamelons are usually visible in a newly erupted tooth, or in a child, but you'll usually not be able to see mamelons in an adult, specifically in the 2nd and 3rd decade of life. And if you're able to view mamelons in the 2nd and 3rd decade of life, it means there has been no wear and tear on these teeth, and it means that there's possibly an open bite. I mean, the teeth are not biting with each other, and that is why there is no wear and tear that's happening. Wear and tear is considered to be physiological; it is normal. Now, wear and tear have a specific pattern, and in this picture, we are talking about this pattern. Now, the wear, or the attrition, usually takes place on the labial of the mandibular incisors and the lingual of the maxillary incisors. And this is the area where they usually contact with each other. And because of their continuous contact during mastication, during chewing, these surfaces, they usually wear off. And one of the examples of this wear and tear is that the mamelons, they usually disappear with function, with age. Now, this is an example of mamelons that have been worn. As you can see, they're partially worn. On some surfaces, there are no mamelons, but and in others you can actually see some remnants of the mamelons. Here all of the three mamelons are present, but they are at different degrees. So, and this is what happens in reality. The way we masticate, the way we chew, our alignment of teeth, our occlusion of teeth results in uneven wear and tear of the incisal surface. Now we'll talk about the mandibular incisors in terms of their relative size and shape. Now, if you view this picture, the numbers written on them are the universal numbering system. The four maxillary incisors are numbered as 7, 8, 9, and 10. And as I've already discussed, the mandibular incisors are 23, 24, 25, and 26. Okay, this is universal number system, and in FDI that will be 1, 1, 2, 1. This will be 2, 1, 2, 2. This will be 3, 1, 3, 2, and this one will be 3, 2, 4, 1, 4, 2. Okay, so if you just view this picture and if you try to compare and contrast only the size and shape of the incisors, you will be able to view that the maxillary central incisors are the largest incisors in terms of size and shape, followed by the maxillary laterals. And then we have the mandibular laterals that are larger in size, and the smallest in size are the mandibular central incisors. Mandibular central incisors are considered to be the narrowest teeth in terms of mesodistal dimensions in our oral cavity, and they're the most bilaterally symmetrical teeth in the oral cavity. So they are the smallest, they are the narrowest in terms of mesodistal dimensions, and also they are bilaterally symmetrical. By bilaterally symmetrical means that their mesal surfaces are actually mirror images of the distal surfaces, and the contact points are both at the same level, and which is the incisal 1/3. So when do they calcify? Now both of the mandibular central and lateral incisors, they both calcify at around 3.5 months after birth. And the only teeth that are calcifying at the time of birth, the only permanent teeth that are calcifying at the time of birth are the first permanent molars. So all of the incisors, be it central incisors, lateral incisors, all of them, they are calcifying, and their calcification they usually initiates during the first year of life. And the crown usually completes around 4.5 years, both of them, the mandibular centrals and the lateral, and they erupt from 6.5 to 7.5 years of age. The mandibular central incisor usually erupts first, and then the mandibular lateral incisors. And as a general rule, the root completes around 3 to 3.5 years after eruption of these teeth. Now we'll be looking at some general similarities and differences between the mandibular centrals and the laterals, so that identifying distinguishing characteristics can be identified. Now they have a relatively straight incisal edge. If you just look at the incisal edge, it is relatively straight. Now if you compare the shape of these teeth from the lingual surface or from the facial surface, all of them they resemble a trapezoid. So the facial and lingual surface of all the teeth, be it maxillary incisors, be it mandibular incisors, all of them they resemble a trapezoid. The facial and lingual surfaces only, while the proximal surfaces they resemble a triangle. Okay, so another important thing is that these teeth they usually taper from the contact point. For instance, if this is the contact point, you can see it is narrowing till it reaches the apex of the tooth, and this narrowing is known as the taper. Okay, so it narrows after the incisal contact point, and then slowly it becomes smaller and smaller until it reaches a conical shape of the apical part of the tooth. And the cemento-enamel junction, it usually curves towards the apex. If you just look at this cemento-enamel junction, it is curving towards the apex. Now another arch triad is that the mandibular central incisors, as we've already discussed, these are one of the most, if you just compare the size and shape, if you just look at it, these are actually quite small. These are usually the smallest teeth. So the crowns of the mandibular centrals are, and as well as the mandibular laterals, they are comparatively smaller in size and shape as compared to the maxillary central and the maxillary lateral. And the contacts are usually found closer to the incisal edge. And the roots are relatively longer. Now, if you look at the incisal view, now the incisal view is when you turn towards the, I don't know if you're able to view this or not. Here it is. So this is the incisal view. Now, if you compare the incisal view of both the centrals and the laterals, I don't know if you can see with the camera. Here you are. Okay, so if you compare them, the maxillary central, they're usually wider, and they're wider mesiodistally as compared to facial-lingually. Okay, while they have, the mandibular centrals, have smoother lingual surfaces. Now, these are the mesiodistal dimensions. These are the mesiodistal dimensions demonstrated by the red, and by the yellow are faciolingual dimensions. These are the faciolingual dimensions. So if you just look at the maxillary central, it is wider mesiodistally than faciolingually, while the mandibular central is wider faciolingually than it is wide, and it is narrower mesiodistally. Okay, so mesiodistal dimensions are greater in the maxillary centrals and laterals, while the faciolingual dimensions are greater in the mandibular central as well as the mandibular lateral. The cingulum, as you can see, the cingulum is quite large in the maxillary central, while the cingulum is quite small. This is the cingulum by the green, and the cingulum here in the mandibular central as well as the mandibular lateral is quite small. Okay, so now if you draw a perpendicular from the mid-root section, if you divide the tooth into two halves, whether it's the maxillary central, whether it's the mandibular central, then the incisal edge will be slightly towards the lingual to the mid-root axis. So the incisal edge will be slightly lingual. Okay. So now this is a picture of a mandibular. There are different varieties of mandibular incisors, and the above here you can see the central, and the below picture there are the lateral incisors. Now, if you just compare that there is different varieties of mandibular central that are present, but as I have discussed earlier, that they are bilaterally symmetrical. But if you just look at the incisal edges, some are straight while some are slant. Now, incisal edges, and here you can see the incisal edges here, that they are not straight, although we are taught that they are straight. So what happens is, in reality, in terms of function and how they masticate and how the wear and tear takes place, that is why usually when they erupt, they are straight. But depending on how the teeth are occluding and how the upper incisor is contacting the lower incisor, the relative wear and tear takes place. Okay, so we had already discussed in the relative size and shape that the mandibular central is considered to be the smallest or the narrowest tooth in the oral cavity, and the mandibular lateral is actually larger in size than the mandibular central incisor. This is in sharp contrast to the maxillary central and lateral incisor. The maxillary central incisor is usually larger in size in terms of mesiodistal dimensions, in terms of faciolingual dimensions, as compared to the maxillary lateral incisor. And another important feature is that both the mesoincisal as well as the distal incisal line angles are equal. So we're talking about the mesioincisal, and here the distal incisal line angles are almost equal. Okay, but in the mandibular lateral incisor, the distal incisal line angle is slightly rounded, while the mesioincisal is much more sharper. So this is another identifying distinguishing characteristic of mandibular central incisor as compared to the mandibular lateral incisor. Now we'll be just looking at the we have already discussed that the mesioincisal line angle is almost equal to the distal incisal line angle, while the distal incisal line angle is much more rounded on the mandibular incisor. Now in terms of contact area, the contact area on the mandibular central incisor, the mesial and distal contact area is almost in the incisal 1/3. Here is the contact area, and they're both almost at the same level. So that is why these teeth are considered to be bilaterally symmetrical. They are symmetrical, they are identical. Their contact areas are identical on the proximal surfaces, and that is why they consider to be the most narrowest and the most bilaterally symmetrical teeth in our oral cavity. While in the mandibular lateral incisor, the mesial contact, the mesial surface has a contact which is much more incisal as compared to the distal contact, which is much more distal. So you can compare the contact areas. The contact areas on the mandibular central, they're almost at the same level, and that is the incisal 1/3, while the contact area on the lateral incisor on the mesial surface, it is much more incisal, while here on the distal side it's much more towards the cervically placed. Okay, so now we're comparing the roots. Another important thing that we need to discuss, we'll be just looking at the root morphology, but the root canal morphology and the root canal configurations, will be having a separate online session or separate lecture on the root canal morphology. So the mandibular incisor roots, they appear to be longer as compared to their relative crowns, as compared to the maxillary teeth. So, although the crowns are quite small, but their roots, they seem to be larger as compared to the maxillary central. Now sometimes what happens is the mandibular central is usually straight, but in some teeth there's a distal curvature, so they are distally curved, while the lateral incisor has a prominent distal bend to the apical area. If you just look at it, you can actually see that the teeth are actually bent towards the distal. So, and this distal bend and this distal curvature is usually found on the mandibular lateral as compared to the mandibular central. And this is the lingual aspect of the mandibular central as well as the mandibular lateral. And if you just look at the below, the rounded circles are actually the area where the cingulum is usually found. The cingulum is usually much more larger in the mandibular lateral as compared to the mandibular central. Mandibular central teeth are relatively straight, bilaterally symmetrical, and they appear to taper. Okay, another important feature which can be viewed from the incisal view is the comparison of cingulum. So if you just look at the cingulum of the central incisor and the cingulum of the lateral incisor, the cingulum of the central incisor, although it is little bit distally placed, but it is slight as compared to the distal placement of cingulum on the mandibular lateral incisor, and this distal placement is said to be distally in comparison to the mid-root axis. What do we mean by mid-root axis? So if we cross section this teeth in half, this will be the mid-root section, and this will be the mid-root section. So this the cingulum, as you can see on this side, it is much more distally placed as compared to the central incisor. And in books it's written that the cingulum of the lateral incisor is offset distally. But what do we mean by offset distally? By offset distally, mean it is more distally placed as compared to the mandibular central incisor. Okay, another important feature is that the mandibular incisors have minimal marginal ridges. They are not as prominent on these incisors. Marginal ridges can be viewed from the lingual aspect as well as the labial aspect. And the lingual fossa is also not so deep, it is very shallow. Another important thing is that if you just view the roots from the proximal aspect, be it the mesial aspect or the distal aspect, you'll be able to see a depression, a longitudinal depression on these teeth. And these longitudinal depressions are found on the mesial surface as well as the aspect. Now, this is the area where you can actually see a depression. If you just view this tooth from this mandibular central incisor from the mesial aspect, you can actually see this longitudinal depression. And the name of this is, if it's on the mesial side, is known as the mesial longitudinal depression. While here, it is also present on the distal side. From the proximal view, you can actually see this depression much more clearly. And if you just view these teeth, they are much wider faciolingually than they are mesiodistally. So mesiodistally, they are quite narrow, and they are considered to be the narrowest teeth, the central incisor, followed by the lateral incisor, while they are much more wider in terms of faciolingual dimensions, and the faciolingual dimensions can be viewed from the proximal aspects, while the mesiodistal dimensions can be viewed from the labial or the lingual. Okay, another important or identifying distinguishing characteristics of the mandibular lateral incisor is that it has the incisal edge has a disto-lingual twist. So distally, the incisal edge on the distal edge is curved little bit to the lingual side, while the mandibular central incisor has no disto-incisal or disto-lingual twist. We'll be looking at the disto-lingual twist when we go to the third part of this online session in the detailed description. And I've shown you the I'm showing you the distolingual twist. What is the distolingual twist? So if you view the mandibular lateral incisor from the mesial aspect, you can actually see the distal aspect as well. Okay, and you can actually see the lingual fossa as well, and both the marginal ridges. This is possible. Why? Because of the distolingual twist. Now, what is a distolingual twist? The mandibular, if you, this is the incisal view of the mandibular lateral incisor. As you can see, the mesial surface, instead of being straight, it curves little bit distally and lingually, and this distolingual curvature of the incisal edge is known as the distolingual twist. And because of this distolingual twist, you can actually view the lingual surface as well as some portion of the mesial aspect from the mesial view. Okay, but you cannot view the same surfaces from the distal aspect. From the distal aspect, you will only be able to see the distal view, but not the mesial view. Okay, now cemento-enamel junction, one of the tooth form generalizations is that the cemento-enamel junction curves more on the mesial aspect as compared to the distal aspect, and the difference between the curvature on the mesial as compared to the distal aspect is around 1 millimeter. Okay, another thing is the buccolingual contours. The buccolingual contours are also known as the cervical ridges. Wheeler's calls it cervical ridges, while Berkowitz calls it the buccolingual contours. And by contours, we mean the most bulbous part on the facial aspect as well as the lingual aspect. So, and both of them, they are found on the cervical aspect. These buccolingual contours or the cervical ridges are present where they're usually present on the cervical aspects. They're almost on the cervical 1/3. All mandibular incisors, they have very smooth lingual surfaces, with very shallow fossae. By shallow fossae, we mean that the fossae, they're not as deep, they're not as prominent as the maxillary central and the maxillary lateral incisors. And one of the features of fossae in the maxillary central and the lateral is that they usually have a pit inside them, which is known as the lingual pit. But these pits are usually not present in the mandibular central as well as the lateral incisors fossae. And the reason why is because the fossae, they are not as deep as the maxillary central and the maxillary lateral incisors. Okay, now we'll be just briefly looking at the roots of these teeth. Um, um, we had already viewed the proximal aspect. From the proximal aspect, the roots are wider facial-lingually. The whole tooth is wider facial-lingually as compared to its mesiodistal dimensions. And they have mesial and distal root depressions. Now, what is the clinical significance of these root depressions? The clinical significance is that due to these, since they are quite narrow teeth, they need to be anchored, they need to be placed more in the alveolar bone or the alveolar socket. And these developmental depressions or these mesial and distal longitudinal root depressions help to anchor the tooth or embed the tooth within the alveolus. So these are the mandibular incisors from the incisal view. All these pictures, they have actually been taken from the book Dental Anatomy by Wolfel, and it's probably the 9th edition. If you just view it from the central incisors and the lateral incisor, you will be able to see that they have different degrees of curvatures, and these curvatures are much more prominent in the lateral incisor. If you just look at this tooth, has the just look at the distal lingual curvature. The distal lingual curvature is quite prominent in the mandibular lateral incisor. Okay, now this is what I've been talking about, that the mandibular teeth, their facial lingual dimensions are quite greater as compared to the mesiodistal dimensions. This is in sharp contrast to the maxillocental and the maxillolateral incisors. The maxillocental and the maxillolateral incisors, their mesiodistal dimensions are quite wider as compared to the facial lingual dimensions. So mandibular central incisors are symmetrical, and the laterals, they are not symmetrical. Why they are not symmetrical? Because of the distolingual twist. And the mandibular lateral incisor has a cingulum which is offset to the distal side, and this offset to the distal side is because of the distolingual twist, while no such distolingual twist occurs in the central incisor. Now this part, we have come to the third part of this this section, and this section we'll be looking at the detailed description of the mandibular central incisors. So we'll be looking at all of the 5 views: the facial view, the lingual view, the mesial view, and the distal view, and lastly the incisal view. And so we'll be looking at it comprehensively, and lastly we'll be looking at the key features that can be used for identifying these teeth. Okay, so the crown outline is trapezoidal. As we've already discussed, the incisal edge is straight. The mesial and incisal line angles are both said to be sharp, and they are 90 degrees. So these are 90 degrees and this is 90 degrees. And the mesial and distal proximal contact areas are both within the incisal 1/3. The incisal 1/3 is quite relatively flat, while the cervical 1/3 is convex. This is the convex part of the distal line. Let's look at the lingual view. This is another of the facial aspect. The mesial outline is quite straighter as compared to the distal outline. The crest of curvature of the cervical may be slightly distal to the mesiodistal line angle. So this is the cervical line, and I'll show you by the dark blue color. This is the crest of curvature. The line which is crossing is known as the crest of curvature. the most bulbous part or the most convex part of the cervical line is known as the crest of curvature, and it is slightly distal to the mesodistal directions. The root converges to a relatively pointed apex. The apex or the apical part of the root may be slightly towards the distal side in the mandibular. Now we'll be looking at the mandibular lateral incisor. The lingual outline is very similar to the facial outline, except that it has a shallow lingual fossa, which is shown by the green. This is the lingual fossa, and this lingual fossa is trapezoidal in shape, while uh, it has a small cingulum. It has probably the smallest cingulum in the oral cavity. So not only it has the smallest or the narrowest size in terms of shape and size, but also the cingulum is quite small. Now this is the mesial aspect. The incisal edge, as we have already discussed, it is slightly lingual to the facial-lingual bisector. Now this line is showing the facial-lingual bisector, and the lingual edge or the incisal edge, it is slightly lingual to this facial-lingual bisector, and that is why on the mesial aspect there's around 0.5 millimeter of more enamel found as compared to the distal aspect. The cervical ridges are the lingual contours, which I will be showing you in red color. This is the lingual height of contour, and this is the facial contours. And both of these contours are known as cervical ridges. Now, and these cervical ridges, they are around 1 millimeter more than the cervical line, and both of them, they're not as prominent as in the maxillary centrals. And another important feature that can be viewed from the mesial aspect is the longitudinal root depression. This is the longitudinal root depression that is usually found, and the purpose of this longitudinal root depression is anchorage, or it helps in fixing the tooth in the bone. Now, the distal aspect. The distal aspect is very similar to the mesial aspect, and the incisal edge is also lingually placed. The cervical line curves incisally for a relatively shorter period, so the crest of curvature of the cervical line is much more on the mesial aspect, while it is quite around 1 millimeter less than on the distal aspect. The longitudinal root depression will be present on the distal surface as well, and the apex of the root will be within the facial-lingual dimensions. So if we section this tooth facial-lingually, if we draw a line, it will pass through the apex. And finally, the incisal aspect. If you just look at the incisal aspect resembles a diamond, and this is why it is known as the diamond-shaped incisal view. The facial-lingual dimensions are actually greater than the mesodistal dimensions. Now, by red, I will show you the facial-lingual dimensions. So if you compare this is the facial-lingual width, and I will compare it with yellow, and these are the mesodistal dimensions. So the red line is actually larger in size as compared to the yellow line, and the yellow line is the mesodistal dimensions. The mesofacial and distal line angles are quite straight. They are 90 degrees, and they are both at the same level, and this is the incisal 1/3, and that is why it is known to be bilaterally symmetrical. The crest of the cingulum is slightly distal to the mesodistal diameter. Now, the crest of the cingulum, this is the cingulum, and this is the crest of the cingulum. It is slightly distal to the mesodistal bisector. What do we mean by mesodistal bisector? If you cross this line into half, then the cingulum will be found a little bit distant to this line. But overall, it is quite bilaterally symmetrical. Now, what are the summary or the take-home messages of the mandibular central incisors? The incisal ridge or the incisal edge is slightly lingual to the facial lingual dimensions. The lingual fossa is quite small. It is quite shallow. It has no lingual pits and it is trapezoidal in shape. The mandibular central incisor is considered to be the narrowest tooth in terms of mesiodistal dimensions, and it is also the smallest tooth. But it is also bilaterally symmetrical. Bilaterally symmetrical means that the contact areas are both found at the incisal 1/3, and the mesioincisal and distal incisal line angles are both acute angles. They are both 90 degrees. This tooth, be it the crown or be it the root, it is much wider facio-lingually than mesiodistally. And lastly, it has developmental depressions on both the mesial surface as well as the distal surface, and these developmental depressions are known as longitudinal mesial root depression and longitudinal distal root depression. On rare occasions, it can have two roots, and if there are two roots, then they will be labeled as the facial root and the lingual root. Okay, so the mandibular lateral incisor, and we'll be comparing it and contrasting with the mandibular central incisor. So the lateral incisor, the lingual aspect, is actually the reverse image of the facial outline. From the facial outline, the mesioincisal line angle and the distal incisal line angles, the distal incisal line angle is quite round as compared to the mesial. Here you can see the distal incisal line angle, it's quite round, and if you just look at the incisal edge, it is not straight but it is slanting towards the distal aspect. The lingual fossa here is also trapezoidal, and both the contact areas are not bilaterally symmetrical. This is not a bilaterally symmetrical tooth, and the reason why is because the contact area on the mesial aspect is much more on the incisal aspect, while on the distal aspect is much more on the cervical aspect. It's much more cervically placed as compared to the mesial aspect. There are no root depressions which are found on the lingual surface or the labial surface. Now, if you look at the mesial aspect of the mandibular lateral incisor, the incisal ridge is also lingual to the facial lingual bisector as in the mandibular central incisor. Also, the enamel is around 0.5 millimeter more on the mesial aspect because of the crest of curvature of the cervical line. This is the cervical line, and the crest of curvature is the most convex part of this cervical line, and this is the crest of curvature. And the height of the contour, this is the height of contour, this is both of the contours, and the most bulbous part is the height of contour. So this is the height of contour here, and this is the height of contour here. As you can see, the height of contours, they are not parallel to each other. It is much more higher on the mesial aspect as compared to the distal aspect. And another very important feature, and one of the distinguishing and identifying features of mandibular lateral incisor, is that you can actually view little part of the distal aspect. You can actually see the lingual fossa as well from the mesial aspect, and this is all because of the distolingual twist. The incisal edge is tilted distally and lingually, and because of the distolingual twist, you can actually view the little part of the lingual surface as well as the distal marginal ridge. There is a mesial longitudinal root depression, which is found on the mesial as well as the distal aspect. Now, the distal aspect is quite similar to the mesial aspect, except that you cannot view the mesial outline, the mesial marginal ridge, or the lingual fossa, or the lingual surface from the distal aspect because of the distal lingual twist. The distal lingual twist, it actually covers all of that surface, so you're not able to see it. So the distal surface is not the mirror image of the mesial surface as in the mandibular central and the mandibular lateral incisor. The cervical line also curves less incisally than on the mesial. So this curvature is also quite less, and how less it is? It is around 1 millimeter less than the crest of curvature on the mesial aspect. Okay, so the mandibular lateral incisor in terms of incisal aspect, the facial-lingual dimensions of all the mandibular centrals and the laterals are greater than the mesodistal dimensions. The mesial contact area is also centered facial-lingually. The incisal ridge will be lingual to the facial-lingual bisector. Uh, Another important view, if you just look at the incisal edge, instead of being straight, it is more curved on the distal aspect, and this is because of the distolingual twist. I will show the distolingual twist by this yellow picture. This yellow circle shows the distolingual twist. Another important feature is that the cingulum is offset towards the distal side. It's much more present on the distal side as compared to the mesial side, and these are the identifying and distinction characteristics of mandibular lateral incisors. So the distolingual twist or the distolingual rotation causes the tooth to be curved little bit to the distal. What is the clinical significance of this distolingual twist? The reason why this distolingual twist is present is so that it can make contact with the canine. So in order to make contact with the canine, the surface is twisted a little bit on the distal side and on the lingual side. So this is a summary of the take-home messages of the mandibular lateral incisor. Of all the permanent incisors, the mandibular incisor has the highest tendency to have two canals, one facial and one lingual, and it is also has the highest tendency to have two roots. And if there are two roots, there will be the facial root as well as the lingual root. The lingual fossa is shallow and it is trapezoidal in shape. The whole size and shape of the mandibular lateral incisor is larger than the mandibular central incisor, but it is smaller than the maxillary lateral and the maxillary central incisors. Both the mesial and the distal proximal contacts are located in the incisal one-third of the crown, but the mesial contact area is much more incisal as compared to the distal contact area. This tooth is not bilaterally symmetrical as the mandibular central incisor, and the reason why it is not bilaterally symmetrical is because of the twisted appearance, and this twisted appearance is because of the distolingual twist of the incisal edge, and this characteristic is best seen from the mesial aspect. The root is ovoid, the facial lingual dimensions are greater than the mesodistal dimensions, and this tooth is actually larger in size than the mandibular incisor. Now, just a brief comparison between the permanent mandibular incisors. The central is smaller than the lateral. The central is much more angular because of the distolingual twist. Both roots have mesial and distal longitudinal root depressions. Incisal edge is straight on the central, while the incisal edge on the lateral exhibits a lingual twist. The central incisor is bilaterally. Okay, another important feature is that the cingulum on both the mandibular central incisor and on the mandibular lateral incisor are both offset slightly to the distal. It means they are the most pulpous portion of the cingulum on both the mandibular central and the mandibular lateral incisors is found a little bit on the distal side. Furthermore, if we compare the mandibular central and lateral incisor with the maxillary central and lateral incisors, then not only are they relatively smaller in terms of size and shape, but also their lingual surface anatomy and their facial anatomy is not as prominent, it is not as exaggerated as the mandibular central incisor, as the maxillary central incisor. For instance, the lingual fossa on the mandibular central and the mandibular lateral is not as deep as the maxillary central and the mandibular lateral, and as well as the cervical ridges found on the maxillary central and the lateral incisors. They are quite large as compared to the mandibular central and the lateral. Furthermore, as we have already discussed, that the mandibular central incisor is bilaterally symmetrical, and one of the reasons why it is bilaterally symmetrical is because the contact areas are found both on the incisal one-third
of the mandibular central incisor as well as the mandibular lateral incisor. Since both of the contact areas are on the incisor 1/3, that is why the embrasure that is formed through these contact areas is quite small and is considered to be the smallest embrasure found in the oral cavity. Now, in terms of the crest of curvature, the cemento-enamel junction, it is more on the mesial aspect as compared to the distal aspect, and this is evident in both the mandibular central incisor and the mandibular lateral incisor. And from this crest of curvature on the mesial aspect, this can be taken as a identifying and distinguishing characteristic whenever we are trying to find out the quadrant, whether it belongs to the right quadrant, whether it belongs to the left quadrant. So in brief, these are the summary and comparisons of the permanent mandibular central incisor and the mandibular lateral incisor. One last thing that I would like to add is that the mandibular lateral incisor, sometimes it has two roots, and if there are two roots, one root will be the facial root and the other will be the lingual root. And out of all of the four incisors, there's great preponderance. There's chances of the mandibular lateral incisor to have two canals and two roots respectively. So that is all for the mandibular incisors. If you have any questions, please don't hesitate to ask or comment. Thank you once again. Bye.